So I'm going to be talking about the HIV/AIDS crisis in Iran. So the Middle Eastern region is often left out of popular discourse surrounding the HIV/AIDS crisis. Despite the lack of awareness surrounding the crisis in this region, many countries have struggled with this epidemic. Iran in particular has faced a unique set of challenges brought about by the HIV/AIDS crisis. So I kind of wanted to talk about this topic because throughout my um, education, I've learned a lot about this crisis in other parts of the world, especially South Africa and the United States. But the Middle East is not something that we really talked about, so I was curious as to how this region had been affected, because I know that in other regions it has had some really devastating consequences. So, a little background: Iran has the highest rate of HIV infection in the Middle East, and HIV rates have been rising in Iran, and there are currently around 61,000 recorded cases. But because of the stigma surrounding being HIV positive, a lot of people go unreported or don't get tested in the way that they should, or don't go in to receive care. So the actual number of people living with HIV/AIDS is probably closer to 120,000, which is significantly higher. And so the main at-risk populations for HIV infection are drug users, female sex workers, and prisoners. So this isn't really a common problem among the general population, but within these specific categories, there are pretty high infection rates. So here's a graph of the Middle East and North African region, and as you can see, there's 240,000 people living with HIV in this region. And as I said before, at least 61,000 of those people are in Iran. So there's a pretty significant chunk of people in this region that have HIV/AIDS are living in Iran. So the first reported case of HIV/AIDS in the Islamic Republic of Iran occurred in 1987 after a blood transfusion for a 6-year-old child with hemophilia happened. So then government officials quickly dismissed the disease as low priority compared with other pressing issues like the economy, war, unemployment, and education. And as stated in a 2003 World Bank report, low prevalence does not equate to low risk. So even though the actual numbers of people that are HIV positive are relatively low, that doesn't mean that it still isn't a big issue that needs attention. So the lack of immediate action led to the rapid spread of HIV in this region. So there are a few cultural elements that play into the reason why there's such a stigma surrounding HIV/AIDS. So Sharia law prohibits homosexuality, sex outside of marriage, commercial sex, and drug use, and these are the most prominent reasons for the spread of HIV. So this will cause people to hide their HIV/AIDS status because of the connotations that are associated with being positive. And this lack of transparency has been increasing the transmission rate, because if people aren't forthcoming about their HIV status, obviously the spread of it is going to be more prominent. There's also an Islamic belief that the body belongs to God and should not be altered or damaged in any way. So this further stigmatizes drug users and people engaging in unconventional sexual practices, which decrease the odds that they'll seek out treatment. So drug users have the highest rate of HIV infection in Iran. And Iran was once a major global center of opium cultivation and distribution, with opium accounting for nearly a quarter of the nation's export revenues in the 1920s. And so this sort of the large quantity of drugs that were circulating within the country created easy access to them. So by the mid-20th century, over 10% of Iranian adults were drug users, including 1.3 million regular opium users. So the highest percentage of people living with HIV/AIDS in Iran are drug users at 9.3% in 2019. And some of the reasons for the high rate of infection are unsafe injecting practices and sharing of needles. So approximately 68% of HIV positive people acquired it through unsafe injecting practices. And more women and young adults have started using drugs in recent years, so this has obviously added to the increase in infection rate because the demographic of people using drugs and becoming susceptible to the spread of HIV is growing. So there are a lot of social impacts that go along with being HIV/AIDS positive because of the sort of religious, connotations that go along with it, and the cultural sort of stigmas that surround it. So HIV positive people encounter numerous problems such as discrimination, losing social status, changes in relationships, and losing jobs and financial resources. So there was a study conducted that found that after the diagnosis of HIV/AIDS among people, job loss increased from 5 to 52%. So that's a pretty significant jump, and whether it's due to sort of the deterioration in health that you see that it goes along with HIV, being HIV positive, or if it's sort of due to the stigmas, both of those are factors that sort of cause this high rate of unemployment. Low social awareness regarding HIV/AIDS leads to the mistreatment of people with this disease. Exclusion from society and even familial relationships has severe psychological impacts on people living with HIV/AIDS. So obviously there's a high rate of depression, anxiety, and suicide within this demographic. So Iran has been implementing a lot of prevention strategies in recent years. So education of the general population is one of the most prominent strategies, and it has become central to Iran's plan to decrease HIV/AIDS prevalence. So there are a lot of community-based activities such as sporting events, which have been held to raise awareness. And there's also been the establishment of phone hotlines, online AIDS sites that are updated periodically, and educational information in public spaces, whether that's the public schooling system or other public buildings, modes of transportation, bus terminals, things like that. By September 2014, there were 580 centers that delivered free needles and syringes to drug users. These centers are operated under the supervision of Universities of Medical Science or the State Welfare Organization. And like I said before, HIV rates are so high among drug users because of unsafe injecting practices and the sharing of needles. So because they're giving out these free needles, they've seen a decrease in HIV infection rates. The establishment of triangular clinics has also been a big help in combating the increase in transmission rates. And so these triangular clinics offer counseling as well as a comprehensive HIV and drug addiction treatment, care, and support. And so the provision of ARV therapy for prevention of mother-to-child transmission has been placed in the National Care and Treatment Guidelines since 2006. So this has been a part of prevention strategies for a while now, and combating it at that level is obviously very important because you don't want children being born HIV positive and then having to seek out their own sort of form of treatment. So sort of cutting it off before it even begins is a very effective prevention strategy. And so these triangular clinics offer reproductive health services and ARV therapy to pregnant women, as well as care and treatment of infected children. So these triangular clinics are very comprehensive. They have sort of all the different levels of treatment that you may need. And they have been very helpful in combating the increase in HIV infection rates. So moving forward, in Iran, HIV prevention and treatment strategies need to be integrated within the existing religious, cultural, and social context. And this could help combat some of the stigma that surrounds HIV/AIDS in Iran. and also the establishment of appropriate healthcare resources, close collaboration with religious leaders, and adequate infrastructure should take precedent. Because if religious leaders show public support for HIV/AIDS treatment plans, it can encourage more people to seek out treatment, and being HIV positive would be seen as less shameful, and society would be more accepting of these people. So overall, a lot of the issues that we're seeing due to like cultural, social beliefs would be easily combated if sort of religious leaders came out and said that this wasn't sort of something that people should be ashamed of, and people should go out and seek treatment. I think there would be a lot less stigma surrounding being HIV positive and then seeking out treatment. So the overall transmission rates would see a pretty significant decrease.